Changes in wall layers may help to indicate the presence of disease. Decreasing depth and measuring stomach wall layers on every patient forces us to note the layers and the thickness. In some cases, the stomach wall layers may have a normal appearance and proportions, but the measurement proves abnormal thickening. Sometimes the area measured is normal, but when depth is increased, the eye notices other areas of the stomach wall that are abnormally thickened. The stomach wall layers are clear and distinct in this 16-pound Pomeranian with suspected multicentric lymphoma of the spleen. The mucous membrane layer and submucosal layers seem disproportionately thickened, and the wall measurement of 5.9 millimeters exceeds the maximum of 5 millimeters for a large dog. This measurement could suggest inflammation, gastritis, or infiltration with neoplasia. Gastritis shows a diffuse or localized wall thickening with decreased motility. The stomach wall layers are clear and distinct in this 6-year-old cat weighing 8 pounds. The wall measurement of 2.9 millimeters is too thick for a cat. Normal is 2.0 millimeters. The cat has not been fed in 21 hours, and yet the stomach is full of food and not contracting at all. The cat seems hungry, but only eats about a tablespoon of food and then walks away. The cat is losing weight and has occasional diarrhea. The eventual diagnosis was inflammatory bowel disease. The muscularis layer appeared thickened and contains hyperechoic speckles in this 77-pound Rottweiler with gastritis secondary to pancreatitis. The measurement of 4.6 millimeters does not exceed the maximum thickness for a large dog. Gastritis due to overstretching or bloat resulted in irregular thickening of the cranial stomach wall in this 7-year-old 90-pound American Bulldog. The muscularis layer is thickened and measures 6.3 millimeters, exceeding the maximum thickness of 5 millimeters for a large dog. The mucosal layer is severely thickened and rugal folds become blunted in this 11-pound toy poodle with vomiting, anorexia, and lethargy. All 5 wall layers can be seen, but the mucosal layer does not have the usual hypoechoic echogenicity, and the muscularis layer varies in thickness. This appearance suggests acute edema and is a form of gastritis. In contrast, in a contracted or collapsed stomach, the rugal folds show the wall layers penetrating into the lumen of the stomach. Here is another example of an edematous stomach wall in a dog with pancreatitis. The mucous membrane layer is thickened and shows increased echogenicity. The stomach wall is regionally thickened and shows a loss of wall layers in this 66-pound collie, showing poor appetite and weight loss. Loss of wall layering often indicates neoplasia. The diagnosis was gastric carcinoma. Malignant gastric tumors tend to be incurable. This 8-pound, 13-year-old Pomeranian was vomiting a brownish liquid 3 hours after eating. Ultrasound showed a large hypoechoic mass attached to the stomach near the pylorus. The muscularis of the stomach wall is irregularly thickened. Did you notice the hyperechoic fat around the stomach and the mass? This mass was surgically removed and the patient recovered. Histopathology showed a fibromatous neoplasia. This video shows a leiomyosarcoma of the stomach wall growing into the lumen of the stomach. In another case, a leiomyosarcoma of the stomach wall was growing outside of the stomach. Lymphoma of the stomach wall is the most common feline stomach cancer. Note severe thickening of the stomach wall with a loss of wall layering. More cranial parts of the stomach wall appear to have normal wall layers, but the wall measurement is still too thick for a cat and suggests infiltration. This 15-year-old 5-pound cat was losing weight and not eating. Fine needle biopsy showed lymphoma. After a positive response to chemotherapy, the stomach wall returned to normal thickness, and the cat was eating and gaining weight. Remission lasted for about 1 year. Remember, when gas is present in a normal stomach, the gas artifact is seen distal to the hyperechoic mucus layer of the stomach wall. In this video, the green arrow is pointing to gas artifact that seems to be inside of the stomach wall itself. Loss of mucus and the mucous membrane layer near this area allowed small air bubbles to move to the submucosal layer. How many stomach contractions do you see during the video? There were none. Also note the severe thickening of the stomach wall and loss of wall layers in this dog with gastric carcinoma. Ulcerations of the gastrointestinal system are subtle. In this dog with pancreatitis, the mucous membrane layer of the ventral stomach wall has a defect, filled with mucus and extending to the submucosa. The mucus protects the defect and may allow it to heal.